Hey everyone, it's Hina Sheth here at Rebalance Physical Therapy and Wellness. And for those of you who are my YouTube followers and my YouTube community, we have heard so much feedback from all of you about wanting a solution for the pain that you guys are experiencing. And so for 2 years now, I've been putting out YouTube videos to just help many of you understand and help you understand that this is not all in your head and that there is a problem that is fixable and there is a solution for this. And what the feedback we heard is, can you please tell me what we need to do? We cannot get to you. And so our goal for this program was to actually do that, to give you guys treatment, ways that you can kind of self-treat to help you with this. But for those of you who have not followed me on YouTube or do not understand basically what I'm talking about, I want to take you through this presentation just in case you haven't been following me on YouTube and you're trying to understand what might be going on, because I think this pertains to this will be very helpful for you guys to understand. So for those of you who are my YouTube followers, just bear with me, because some of you, this is going to be some repeated information, but it'll still be helpful. So, are you suffering from any of these issues? Testicular, scrotal, penile, epididymitis type pain, tightness and pressure. Oftentimes people will tell me that this kind of feels like a golf ball in their rectum, or like a vice-like grip that just, ruins their day. Testicular heaviness, tightness, swollen scrotum or pain in their scrotum. Do you have lower abdominal pain, pressure, and tightness that you're experiencing? Sorry, I gotta move my screen around. Lower abdominal pain that, maybe you've tested negative for a hernia, or if a hernia was there, it was too small that it wouldn't seem like it would cause this many issues, but it still feels like there's something big going on there. Do you have any rectal tailbone pain, buttock pain, pressure, or tightness, especially with sitting? Urinary pain, hesitation, frequency, burning, and spasming? Do you have pain or tightness with bowel movements? Oftentimes people tell me they have to brace with having a bowel movement. They feel like it's glass-like when they're having a bowel movement. Pain during and after a bowel movement, maybe incomplete feeling after having a bowel movement. Pain with rectal, prostate exams, takes forever to have a bowel movement, pain in the buttocks with sitting, pain after intercourse, maybe erectile pain, ejaculatory pain, erectile dysfunction, deep pelvic pain after intercourse, arousal dysfunction or arousal pain. Feels like you kind of have a flu in your pelvis after intercourse, or maybe as you're having intercourse. Clothing intolerance. Do you feel like you're constantly adjusting your pants or your crotch region? Do you feel like you need to wear loose clothing? Do you have burning, sharp shooting, stabbing type pain around the pelvis, groin, hip, or low back? And do you feel like you've seen everyone? You've gone to your primary doctor, a urologist, a colorectal doctor, neurologist, pain management, sports medicine. Maybe you've gone to a physical therapist, but nothing's changing, or maybe it's changing, but then it just keeps coming back. Are you kind of tired of, some of you are on antibiotics and medications, and you're not seeing any type of long-term results? You're fed up with doctors at this point and providers. You feel like you're not being understood. You feel like you're being passed from one provider to the other, and no one is giving you a big picture as to what's going on. No real definitive diagnoses, or maybe you're given a diagnosis, but again, no real treatment options. And are some people telling you it's in your head? And then all of this just makes you feel like you're mismanaged, you're misheard, you're frustrated, you're fearful, anxious, and you kind of feel like you're all alone. I get it. This is what all of my patients tell me. And it just affects everybody around you. It affects relationships. It affects, your spouse or your partner relationship. It affects taking care of your children. It affects even being social around your friends. You don't want to go out. You're wanting to have fun is no longer there. What you basically have is something called chronic pelvic pain. And it basically, all of these symptoms that you're feeling, that's what it falls under. And again, it could be any of these things where you're having lower abdominal or pubic bone pain, deep pain in your pelvis or scrotum, prostate, testicles, penis, bladder, rectum, and sigmoid colon, outer thigh or hip region, deep inside the pelvis, tailbone, or sacral region. And you're not alone, okay? This is something I really want you guys to understand. Even though you may have seen a urologist and your primary care doctor and you're being made to feel like we don't know what's going on with you, trust me, we see men at our clinic all the time. 16% of all men have some sort of chronic pain. That's a lot of men. And unfortunately, there's not that many healthcare providers that understand what's going on. These chronic prostatitis type pains, they're like 90% of the prostatitis cases, typically from what we're finding, is that there's no real infection going on, but it's still like this prostate irritation and inflammation type feeling, but there's nothing really wrong with the prostate. Okay, so you can never know who is suffering from this. I'm telling you, we've got all walks of life, all ages of men that are suffering from this, from teenage boys all the way up to people in their 90s. And there's no rhyme or reason as to, if there's a particular ethnicity that is more vulnerable to this. It literally is all types of people and all walks of life and professionals. I mean, I have people around the world that are contacting me in so many different countries that are having this issue. So who am I? It's important for you guys to know what makes me credentialed to talk about this. So I'm Hina Sheth. I'm a physical therapist. I have my master's in physical therapy. I graduated about 20 years ago from a school down in Florida called University of St. Augustine. I'm also a University of Florida graduate, so go Gators. And I basically started specializing in orthopedics, which is basically all the joints in the body. And I became what's called manually certified, meaning I became certified to use my hands to really evaluate and treat the body. So when you become manually certified, you really start to get a specialized feel of what joints should feel like, what tissue should feel like, and then you use your hands for treatment. And I moved to New York, back in 2001, and I started working at a prominent sports clinic there where I was seeing a lot of patients. I was known as the spine person, so I was seeing a lot of patients that had a lot of spine and pelvic pain on the outside. But what they were telling me also, as I took histories of a lot of these people, is that they were starting to have all these other weird symptoms like scrotal pain, penile pain, all these other weird symptoms. And they were wondering, is this all connected? And then that's where I started gaining my passion for treating this on a more holistic level. So I moved to Philadelphia. I worked at the University of Penn. UPenn Hospital, and I started really treating a lot of my patients with this holistic kind of orthopedic approach where I was treating the orthopedic issues, but I really started learning about something called the pelvic floor, which I'll talk about, and trying to combine the knowledge of both of these worlds. And what I realized is that, wow, the whole entire body is connected from the inside out. And my love and my passion for treating these clients really, basically started me to start thinking, hey, I want to treat these patients completely differently, not along the lines of, what protocols were being educated at that time. And I was kind of sick of treating patients in parts. Basically, that's how we were treating. We were treating these things in parts. Like, hey, you got a hip problem? We're going to treat your hip. You got a back problem? We're going to treat your back. But we're not going to treat both of them at the same time. You got a pelvic floor issue? We're not going to treat your hip and your back. We're going to treat your pelvic floor. And I realized this is not the way that I wanted to treat patients. So I started treating my patients more holistically and integratively. Now, at the time that I was also working at UPenn, I was able to participate in a NIH research study, which was involved in pelvic pain. And that research study was one of the basically the rocks that set everything forward for physical therapists to really say, hey, physical therapy with specializing in this particular part can really improve a lot of people's pain. I was also a test writer for the pelvic pain specialty exams. And then in 2008, I actually decided, hey, I'm going to start really doing something on my own that's different, that's not like a cookie cutter approach. And that's when I founded Rebalance Physical Therapy. So now we're a team of 4 currently, treating a lot of patients that are suffering from pelvic pain, and especially our clinic treats a lot of men. And I continue to lecture, and I have lectured for many years in some of the most prominent healthcare institutions here, in Philadelphia, Temple, UPenn, Thomas Jefferson, Hahnemann, you name it. I go to so many different hospital systems talking to urologists, gynecologists, colorectal doctors, sports medicine doctors, etc. So I think that makes me kind of qualified enough. I've treated probably thousands of patients at this point. Okay, so what is the culprit? Why are you guys having this pain? Well, we got to blame some of this on the pelvic floor. Now, what is the pelvic floor? The pelvic floor basically are a group of muscles located deep inside your pelvis that you cannot see from the outside that basically give you function to, gives you sexual function. It participates in bowel and bladder functions. And so these guys are really, really important, but they're deep, so you can't see them. And many healthcare practitioners do not even realize how much of a problem these muscles can be. So this is your pelvic floor. It's located inside your pelvis. And again, importance of it, you can see here on a cross section, you see this area right here that I'm pointing with my cursor, okay? This actually lines around the rectum as well as the urethra, which is the area that you pee out of. And so you can see how this can actually affect everything from bowel and bladder function and sexual function. And these muscles are a part of your core muscle group. Yes, so when you think of doing core exercises, your pelvic floor participates in it. But what happens? Why is it causing you so many problems? Well, these muscles, just like any other muscles in the body, can become super tight. And when they become tight, kind of like a fist that I'm showing here, okay, imagine holding your fist for, like a couple of minutes. It's probably not going to feel comfortable. Now imagine for a couple of hours, a week, years. I know some of you men have been suffering from this from years. So imagine a muscle that's been tight for years. Now, if you hold your fist like this and then you try to open them, imagine just even after a couple of minutes opening your fist, it probably feels really uncomfortable. Well, guess what? That's what's happening to your muscles. Why do they become tight? Why does this happen? There's a whole host of reasons. I can't even put all of them on here, but these are some of the common reasons why these muscles become tight. Incorrect overtraining the core. So incorrect working out. I have so many people that come in and they say, hey, my symptoms started after I did a hard workout, or I've been doing a lot of squats, and all of a sudden I'm starting to feel these symptoms. Poor posture. Believe it or not, the way your posture is governs how your muscles function. Again, like I said, these muscles are like any other muscles in the body. So when you have correct posture, you have nice balance between the front and the side to sides of your body. However, you have bad posture, it affects all different muscles, including your pelvic floor. Extended periods of sitting. Much of our society is doing a lot of activities in sitting, whether it's going to work and being at a computer all day, or if it's biking and doing certain exercises that you think is good for you. But again, it just leads to more sitting. So more periods of being on these muscles that are located in your pelvis and not getting good blood flow to them. Orthopedic injuries and surgeries. So any type of injury, and I'll talk to you about this in a little bit, but any injuries around your hip joint, around your pelvis, abdomen, knee, ankle, yes, all of these injuries that occur kind of outside of this region can have an impact on your pelvic floor. And even surgeries. So many people after any type of surgery, whether it's something like an appendectomy or a hip replacement or some other type of hernia repair, you name it, any surgery in this area can also set off your pelvic floor. So think about hip replacements, hernia, core injury repairs, labral tears, okay, many, many more. Any type of surgery, radiation, scar tissue. So even with surgeries, form scar tissue, okay? Scar tissue is like a scab, and that scab can penetrate deep down. Radiation, okay? Radiation can change the nature of your muscles and your tissue. So imagine any of you guys that have had any type of cancer where you're having radiation targeted to your tissues. And what happens? When you have this scar, when you have any type of radiation, on the outside, everything looks fine, kind of like this iceberg. Seems small, doesn't seem that bad, but guess what? Deep down inside, this scar tissue, radiation, can affect muscles and organs. Yes, organs. So I put this picture here to show like that scar tissue can wrap around different parts of your organs, your bladder, other muscles, and doesn't allow now your organs to function as optimally as they should. And so, not surprising, some of you guys, I hear it all the time. Hey, my symptoms started after I had this surgery. My symptoms started after I had radiation. Or my symptoms started, and is it related to this scar tissue? Or I'm starting to have bowel and bladder issues after many years after a surgery. Why is that all of a sudden? And I know that with all of this, it can cause so much stress, anxiety, and abuse and trauma. But some of you have a history of this in your past. So yes, stress, anxiety, abuse, trauma that's happened a long time ago can actually manifest as pelvic floor tightness, believe it or not. And infections. So if any of you guys have had any type of chronic inflammatory issues or infections, chronic urinary tract issues, chronic fungal issues, surgical abdominal infections. If you've had those for a while, if you've been hospitalized for these things and you're over the infection, but now you're still in pain, well, it could have been actually from the infection causing so much irritation that it actually spilled over into these pelvic floor muscles. And IBS, constipation, and other GI conditions like Crohn's, ulcerative colitis, any other GI issues, they actually, and I'll show you in a minute, how they actually play off of each other. So all of these irritable conditions that are inside the organ actually can spill over into the muscles and cause the pelvic floor muscles to become tight. And this is what I mean. See, here are the muscles on the inside of your body. And guess what's on the inside of those muscles? All your organs and your nerves. So all of these guys can kind of bounce off of each other. And again, for just to show you this picture again, here are your muscles. So if you have chronic irritation, okay, of any of these organs, or, your bladder, your rectum, it can actually set off your muscles. And the way that we know this is there was actually a study done in 1997 where they actually took female rats. Okay, this pertains to you men too, but they took female rats and they injected the uterus of these females with a blue dye and an inflammatory agent, basically mustard oil. And they created this inflammatory response in their uterus. And then after a couple of weeks, they looked to see, hey, did that dye actually stay in the uterus of these rats? And guess what? They no longer found dye in the uterus of these rats. They actually found that the dye went into the muscle and fascial tissues of these rats. They basically went into their stomach muscles, their buttock muscles, their leg muscles, their, did I mention their back muscles? So you can see that dye was no longer in the uterus. It actually spread out into the muscles and the fascia of these rats. So what does that mean? It means that the organs and the muscles talk to each other. They actually communicate with each other. And so when you go to someone and they're like, oh, your organ's not the problem, well, guess what? It could be the muscles that are actually mimicking what feels like the issues are coming from the organs. And so it's kind of like an idea of a crowded elevator. One person that gets irritated makes the whole elevator irritated. Or one bad apple spoiling the bunch. One bad apple spoils everything. So maybe that issue started in one area, your organ, from a surgery, from an infection in one area. But guess what? It spreads out into the muscle tissue. So when they go back to check, hey, the infection's fine. Your surgery's fine. Well, guess what? The tissue around it might not be. And so what happens with all of these things, no matter why you ended up getting these issues, you end up forming something called trigger points, which is basically a knot within a muscle. A lot of us have trigger points. If you take your hand and you put it on your neck muscles in this upper trapezius area, you might find some knots there. And when you press on it, it kind of feels painful, but it feels good at the same time. Well, guess what? That's a trigger point. And that trigger point can basically cause local pain, but it can also cause pain that spreads out into other areas of the body. Okay? And so you can have these trigger points all over. Again, you can see this picture right here. It's kind of like this knot within a big muscle. And when you press it, it can cause pain that can kind of go all over the body. And you have trigger points in your pelvic floor. Okay, now these pelvic floor muscles, they do not work just by themselves. You can see here that the pelvic floor is connected to this pelvis. And there's other muscles that are all around this pelvis that connect into the spine. It connects up into the rib cage. You can see that there's leg muscles here, buttock muscles that also can impact your pelvic floor. Okay, you've got abdominal muscles here that can impact the pelvic floor. So the pelvic floor does not work by itself. It works in conjunction with other muscles. And this is why when you have other issues and surgeries that happen around the hip, around the abdomen, around the low back, low back surgeries, tailbone issues, hamstring pulls, whatever, sports injuries, over time, they can cause problems in your pelvic floor. So again, they don't work by themselves, okay? And fascia. Fascia is another type of tissue that surrounds, it starts underneath your skin and it surrounds all of the muscles in your body. It also surrounds all your organs into your body. And so fascia is kind of like a cobweb that just surrounds organs and muscle tissue all around your body, okay? And when you pull on that fascia, okay, it can affect things all over the body. So it's kind of like a sheet or saran wrap. When you pull on one end of it, it can actually affect another area of the body. Okay, so it kind of feels like this pulling, this tugging, and oftentimes what we hear is that people will start, when they have problems in this fascia, which we see all the time with patients with pelvic pain, is that it feels like they're wearing a scuba suit. And it feels like they might have clothing intolerance. They might feel itchy. It can feel burny as well. All right, and so what happens is you take all of these issues, your history, you take these trigger points, you take sports injuries, surgeries. Many of you have had a bunch of these things going on. And over time, okay, from your history, from when you were younger to now, at whatever age you are, these become layers of problems like an onion, okay? So layers and layers and layers of problems. And what happens is that all of these issues, whether it was a hip issue, postural issue, tailbone issue, bladder issue, sports hernia infections, whatever, now it becomes a pelvic pain issue. So all of these issues can feed into each other like the layers of an onion. And what happens? At some point, maybe when you were younger, you were able to compensate for these issues without a problem, without pelvic pain. You had all these things and it didn't cause a problem. But what happens is over time, all of these little layers of the onion, okay, you were able to balance them at some point, because when you're younger and you're more agile and your tissues are a lot healthier and have viscosity, meaning they have good fluid and good blood flow, you can balance this for a while. But you put in other factors, okay, maybe more problems, age. You're sitting more often now because you're not as active, maybe with a new job or a job that you've been sitting for a while or whatever it is. And these problems start to meld and become one. And now your body can't balance these as well. And so what happens is you reach a tipping point where, all these problems, they were manageable. But then you hit the threshold of pain where your body wasn't in pain, but wham, all of a sudden, this is what we hear with our clients, wham, all of a sudden, one day, this pain in their pelvis came out of nowhere. Well, guess what? They reached a tipping point when it comes to pain. And now they were right at the edge, and now it spills over. And this is what we hear sometimes often, is that some of you have pain, it goes away. But then something easily can set it back off. So now the pain comes back on again, but then it goes away. And then it comes back, and then it goes away. So it's like this roller coaster. Again, it's this tipping point. Your pain can go below the threshold, but it doesn't take much. Stress, frustration, certain types of movement activities that, guess what, spill the pain over the edge. So that's what we often see happens. And so what it feels like is that you're stuck in this race around all of these issues, because what happens is all of these causes, posture, injury, infection, surgery, all the things that we talk about, stress, anxiety, can lead to pain. But pain can also cause these things. Pain can lead to trigger points. Trigger points can cause pain. Trigger points can cause fascial restrictions. Surgery can cause fascial restrictions. Surgery, posture can cause trigger points. You see how all of these things start melding into each other. And then all of these things can cause nerve pain. But hey, you can get nerve pain from surgery. But then nerve pain affects fascia. Nerve pain affects pain. Nerve pain gives you trigger points. Nerve will give you alignment issues. But guess what? Fascia trigger points can cause alignment issues. Posture, injury, infections can cause alignment issues. So all of these things, all of these arrows, basically everything melds into one. And then you get stuck in this vicious cycle of chasing your pain, going to providers where you're not getting answers. Because guess what? All of these things melds into one. So you might be asking at this point, oh my God, my head is spinning. Yes, this is exactly what's going on with me. But what do I do? I've tried treating my pain. I've tried to treat my alignment. I've tried to treat my nerve, my fascia, my trigger point, whatever. Okay? But I still feel like I'm stuck in this rat race. Well, guess what? There's an exit out. There is. So how do you fix this? It seems like this impossible maze, but this is what I'm here for. So we're going to start peeling back those onions. And how are we going to do this? Well, typically when people come, I'm going to move my cursor over here. When people come into our clinic for this reason, this is what I've been treating for 20 years, okay? And even when they do telehealth evaluations and treatments, we look at all these things. We look at the history. We look at the alignment. We look at your flexibility of your joints and your muscles and your fascia, strength. We look for the trigger points, where you have these restrictions. We do an internal pelvic floor evaluation, and we look at all these things, and then we help. We figure that out, how we're going to use our hands to fix these issues for you, and in what sequence, based on your goals and what you want to have treated first. And then we also look at, hey, how is the hip, the neck, the rib cage, the feet, the knees, all of that affecting all of this? And then we help case manage, because sometimes we do need the help of other professionals, other doctors, other people who understand what we're treating to help coordinate this, possibly with certain medications and certain interventions. However, for many of you, knowing how to treat yourself is also equally important. And this is where we teach a lot of our patients how to start self-treating themselves when they come in to our clinic. So not only are we doing all the hands-on therapy, but we're teaching them specific instruction on self-release, stretch, and coordination to support all of the hands-on things that we are doing for our clients, okay, in the in-clinic treatment. So all of this non-highlighted, non-bolded is what we do in the clinic, but then this right here is what we teach our patients to do. And so what we realized is that when I started creating YouTube videos to help people understand what might be going on with them, this was like 2 years ago, we started hearing from many people that there was a lack of good quality information out there to help them. There was a lack of good quality providers. I heard nightmare stories of people, yes, seeing pelvic floor therapists sometimes and doing completely the wrong thing. And what we were having is people reach out to us and saying, can you please help me? I am not finding a good provider in my area, or I am and they still don't get it. And so we realized we needed to create something for our YouTube community and our online community to help them. And so what we decided to do was start a series of things underneath the umbrella of Rebalance VIP. They're Rebalance video integrated programs where we can start teaching you online how to start self-treating yourself like we teach to our clients that come in to our clinic. And so for this particular one, we started a Male Pelvic Pain Solution. And that is the program to start treating all of you who are starting to have pelvic pain issues. And what we address in this particular program is the fascia, the trigger points, and the coordination that's needed to reduce the pain that is being caused from your pelvic floor. So what we want to do is we want to start peeling back those layers. So our program addresses the trigger points that we find that are most common in certain groups of muscles that we need to treat. Address those fascia and the fascial tension that's also contributing to pain. This helps to start improving alignment of the pelvis where these pelvic muscles are, and also improving the inner core coordination, because we talked about how this pelvic floor is part of this inner core, and we're going to learn about that in our program. And all of this will start to help decrease the pain that you are having. And why our program? Well, you've seen how many patients that I have treated. So it's based on not just mine. I actually work with 4 other amazing clinicians. It's based on a comprehensive collaboration of all of our skills, our holistic and comprehensive training. We've taken hundreds of hours of courses and online research to really put into this program. 20 plus years of clinical experience, our expertise in getting 99% of our clients improved, thousands of clients treated at this point. Program is intended to support what we do with our clients in our clinic. So this is exactly what we teach our own clients what to do. It's the most up-to-date evidence-based program. And again, we can also support this with telehealth case management, as well as for those of you who we are able to currently in PA, but possibly in New Jersey and New York, to do online evaluation and treatment in conjunction with this program. So, Male Pelvic Pain Solution, I personally guide you through this program. In 6 weeks, about 15 minutes per day, we want to know that your symptoms are improving. It's about probably 4+ hours of education, instructional videos, and guidance. And there's a downloadable PDF to keep you organized through the program. And it costs less than 1 visit with us in person. So, great. Where do I start? I'm sure some of you guys are wondering. Well, we're going to start right down here. The information is below. If you're watching this on our YouTube, then the information is below, located in the text box. If you are watching this on our website, then again, the information should be below. So just look below, wherever you're finding that you're watching this video. And when the pain is better, what you're going to notice is you're just going to be so much at ease with your anxiety at first, because already probably watching this, you're probably like, oh wow, I'm feeling better knowing that there's a solution, because it's calming your anxiety. But what you're going to find as your pain starts to get better is that there's hope. There's hope, and that there is help out there, and it's going to give you a much better balanced mind because you're less stressed. Obviously, your body is physically going to be better balanced, and you're going to see that, hey, my spirit feels better. I'm feeling uplifted, and my mood is better, and I feel like socializing again. I feel like being a little bit more intimate with my partner, and I'm just feeling better, well-rounded. And isn't that what life is all about? It's a better mind, body, and spirit. So I hope all of you guys are going to join me in this program, and I hope to see each and every one of you start improving your life and your well-being.